So the first thing about being aware of the symptoms of breast cancer, so if you have things like a lump, and that can be in the breast itself or under the armpit or here in kind of over the clavicle area. If you have a lump there that's new, that needs to be checked out. The other thing is if there's any change in the skin of the breast, so any kind of rash on the breast is unusual and that needs to be investigated. Any changes in the nipples, if the nipple is pulled inwards, or if there's any kind of eczema looking changes around the nipple, that all needs to be investigated. But separately, if you have none of those symptoms, so if there's not a concern that there's a cancer there, the other things to be mindful of are things in your family history that might indicate that actually you might be harbouring a high risk genetic risk factor. So what we worry about are things like breast cancers happening at very young ages in the family. So anything, certainly before the age of 40, we would want to see you to talk to you. Even before the age of 50 is a little bit unusual. So, if you have several people on one side of the family affected by breast cancer, we want to know about it as well. So, for example, mum and an aunt and a cousin, we want to see you. The other thing we really want to see are people that have a family history of male breast cancer. So breast cancer in a man, between about 1 in 1,000 to 1 in 100 men develop breast cancer in the general population. Male breast cancer is a kind of a red flag that there might be something genetic going on. So if a male relative has had breast cancer, we want to see you. The other kind of risk factor is if you've had breast cancer on both sides. So if you've had both breasts affected by cancer, that's an indication that you need to see us. And also if you've had breast cancer and another cancer, particularly cancer of the ovary or cancer of the womb or bowel cancer, we want to have a chat to you to see if there's anything genetic going on. So there are the kind of rules of thumbs. Lots of cancer in one person, lots of cancer on one side of the family, very young ages, both sides, men. They're the things to watch out for.